Choices segment, one of those decisions should be not to smoke. And we have Ryan Bartlett, Media Coordinator for the Tobacco Prevention and Control Program at the Utah Health Department. Thank you so much for being here.
Thank you for having me.
Such a good, timely topic as the Utah House of Representatives actually passed on raising the age limit of buying tobacco from 19 to 21. So important, right?
Right.
Let's talk about some of the statistics here in Utah. Mainly kids are influenced in starting this bad habit.
Yeah, so one thing that's important to know right off the bat is that tobacco is the #1 preventable cause of death in the United States. And this is because it often leads, among users, it leads to things like heart disease, lung disease, cancer, and stroke.
So many health issues from smoking that they're so numerous to begin with. And you have a statistic of where 95% of kids start before the age of 21.
Right, so we found that, like you said, 95% of people start smoking cigarettes before the age of 21, and a lot of that is due to peer pressure in high school and just the proclivity of youth and young adults to experiment with new things as they try to find their identity. And so, unfortunately, a lot of the smoking that we see is started under the age of 21.
And do we have a big problem here in Utah of smoking?
So actual combustible cigarette smoking Utah does not have very high rates of that, but what we are seeing is significant rises in vaping and e-cigarette use.
And this bill actually encompasses the Juuls and the other nicotine liquids that kids are buying. And I know anecdotally kids are sneaking in the bathrooms, and because there is no major smell that you can detect, right?
Yeah, so House Bill 324 would include all tobacco paraphernalia, e-cigarettes, vape products. And like you mentioned, one of the things we're particularly worried about here is how easy e-cigarettes are to conceal. People can hide them in their sleeves or their pockets and, take a hit off the e-cigarette relatively quickly without anybody knowing and get that high-level dose of nicotine without people even realizing that it's happening.
And more research does need to be done with the Juuls and the other vaping sorts of devices. But one little liquid thing is as much as how many packs of cigarettes? Something like 1 pack, right?
Yeah, so it depends on the amount that they're using, but what we are seeing is e-cigarettes like Juul are increasing the amount of nicotine that they contain so that they're highly potent.
And I know they've been under fire for targeting kids and in their advertisement and so on. What's your message here of making sure that kids are not starting this habit?
So our message is we would like to encourage parents to speak with their children about this, speak with your teens. A lot of teens are unaware that the products that they're using, such as e-cigarettes, even contain nicotine, and they find themselves using these products and then becoming hooked on them before they even realize that it's a problem.
And how do you start the conversation with parents and finding out and making sure that there is that open dialogue with kids?
Well, one thing that we recommend is that parents visit waytoquit.org and find out some of the information that we have on there about resources that are available to them and to teens, and also to look at the Tobacco Talk. That's something that we recently came up with at the Department of Health, aimed at educating parents about how they can inform their children about these problems.
And it's obviously not one conversation with your kids, but continuing. Much more information on the web if you go to tobaccofreeutah.org. All that information to talk to your kids and to know the ramifications when you start smoking and the long-term effects. And we'll have more actually in the show coming up.